We have had a fascinating morning, and the whole theme has been about change. Will Rogers said that even if you're on the right track, you'll get run over if you just sit there. And I think that's the theme that we've been trying to build on about moving forward with digital transformation foci in healthcare. And we're all about paradigm shifts. And I think we have seen some rather dramatic changes occurring this year already. So here we are in the second part of the day, and the question is, Quo Vadis? After that 1950s movie, where are we going? And how are we going to move things forward? Earlier today, and then subsequently, there'll be a lot more talk about virtual healthcare technology. And this session is focusing on merging lanes, digital healthcare and data privacy, something that has provoked over the last year and a half or so a lot of attention with a lot of thoughts, with a lot of regulatory activity overarching all of this. So as we look at the social media platforms and wearable fitness trackers and other connected medical devices, which are revolutionizing healthcare with their ability to diagnose, monitor, and even treat through data. But the patient data held in these digital systems are governed by laws that predate most online and mobile services utilized today. And without clear-cut policy guardrails, I think we're able to really realize digital health's full technology. The digital healthcare and data privacy initiatives must merge lanes to drive forward practical and protected patient data. I'm a big believer in this. I'm the chief academic officer at the Cleveland Clinic, but I'm a cardiologist, a heart failure, heart transplant, mechanical circulatory support device kind of guy. And so I use and have used for 25, 30 years, digital technology to help me with my patients. More recently, exploding into the virtual visit technology that we use. But there are some frustrations and some limitations. We have a wonderful panel today, and I'm going to ask each one of them to introduce themselves and spend a minute or two talking about the areas that they think are important to consider and where we must drive things forward to complete this paradigm shift that I alluded to. So Samantha, maybe I could turn to you, Samantha Burch, to tell us a little bit about yourself and share some thoughts.
Great, thanks, Dr. Young, and good morning, everyone. It's wonderful to be here and to be on this panel and part of this summit. I'm Samantha Burch, and I'm the Director of Health Information Technology Policy for the American Hospital Association. And in that role, I actively help our members with almost everything. 10 years ago, when I started in health IT policy, well, even longer than that, but we'll just talk in the era of high tech, the areas that I worked on were far more narrow. Now, every single part of healthcare policy is touched by IT and technology. And I think this issue of data privacy in a world where we have legacy regulations that, as Dr. Young pointed out, were developed at a time where no one working on them could have ever envisioned where we are today in terms of what we're capable of doing with data and simply the vast amounts of data that would exist. So I think thinking about the world in terms of both that sort of legacy area of HIPAA protected data, but also everything else. I think HIPAA is now a teeny tiny little island when we talk about the vast ocean of health data that's out there and the importance of how we are able to use that data in order to really drive interventions, better outcomes for patients. So a lot of what I spend my time on is thinking about how do we strike the right balance. And there's no area in innovation policy that I think is more ripe or more critical than the area of privacy. So happy to be part of the discussion.
Thank you. Jacqueline, do you want to go next?
Yes, thanks. Hi, good morning, good afternoon, everyone. Thank you for the invitation to participate in this panel. I head the personalized healthcare data science team in Roche. So at Roche, we are using multimodality data to generate insights that can inform clinical research and clinical care that ultimately benefit patients. We use data that come from different sources, including clinical trial data, as well as the vast data sitting in the real world at the point of care, imaging data, genomics data, apps, wearables, and so on and so forth. So my passion is really to find new and meaningful uses of the growing healthcare data and to make that happen. We see that in the past few years, data are becoming more and more available because of technology. Linking of data from different data sources, from different modalities becoming possible now, and the quality of data has improved tremendously. So there are definitely barriers that need to be tackled before we can fully leverage the power of healthcare data. For example, upscaling the infrastructure, the need of data standards, data privacy definitely is top of mind, just to name a few. More importantly, I think there needs to be a value recognized across the healthcare ecosystem to really incentivize data sharing and the data use. I look forward to the panel discussion today. Thank you.
Thanks, Jacqueline. Appreciate those comments. Tom Lawry, do you want to introduce yourself?
Sure. Hey, everyone. I'm Tom Lawry. I'm the National Director for Artificial Intelligence for Health and Life Sciences at Microsoft. Sitting here, sheltering in place just outside of Monterey, and hope everyone's doing great wherever you are. So when I think about the discussion that you've teed up, Dr. Young, I'm reminded of the fact that we've been here before. So clearly the technological capabilities are out ahead of the regulators and legislators. But if you think back to the late 1990s when the internet was becoming mainstream, you had been hard pressed to find a full-time privacy attorney. And today, the International Association of Privacy Professionals now is 20,000 members strong in 83 countries. We've come a long way. There are many issues that are being spawned through things like use of artificial intelligence and all the data that Jacqueline was talking about that is causing us to have to rethink a number of things around policies, around legal issues, but we will get there just as we did before. Beyond that, I would say for all of the issues we're going to talk about, the reality is the rise of the intelligent consumer is here. They are demanding that we do things differently, and it really is up to the health industry to figure out how to bridge what consumers want with the guardrails we need when it comes to data and privacy and protection.
Well, thanks. We're going to get into that a little bit more deeper because this obviously influences the direction and speed that we can make that paradigm shift. Paul Muret, do you want to make some introductory comments and share some thoughts?
Yes, thanks, Dr. Young. So yeah, my name is Paul Muret. I'm Vice President of Product and Design at Google Health. Consumer health journeys, as Dr. Young was talking about, we're already moving to digital surfaces, but the COVID-19 crisis, of course, has accelerated this dramatically, and I think on all fronts has put our teams in the code yellow situations where we had to react quickly and really get the right information and the right processes in place. At Google, obviously, that became really important across a lot of our primary properties. We were working closely with the CDC and other local health organizations, launching a number of COVID-19 screeners, information panels. The information panels on YouTube have now served actually more than 300 billion impressions, which is incredible. And while that's nothing compared, obviously, to the heroics of the frontline workers, we're proud to be a part of those journeys. And so I think in the past, health journeys would really start when a patient arrives in the hospital or ambulatory setting. But if you look at the increasing capabilities of mobile devices and wearables and new digital experiences, including, like coaching apps and things like that, and, all the way to devices on your kitchen counter, we're increasingly seeing health journeys that start with the consumer at home or on the go. And so as these journeys begin in these different locations, I think that we all have to ask this question about, like, well, what is the paradigm? What is the information governance model here that we're going to be working under? Parts of the journey may be covered under HIPAA, parts may not. Consumers are not going to understand when they've stepped from one space to another, nor should they have to. And so I think the answer here is going to be complex and will require a number of components, including ensuring that we're building on platforms that are really engineered with a lot of this thought to start with, so that security and privacy really built in from the start and can operate across those boundaries. So very excited to be here today on this panel, and looking forward to the discussion.
Well, thanks, Paul. And we'll turn to our last panelist, Don Trigg. And Don, you're not last for any other reason than we went in alphabetical order. So, on to you.
The dubious distinction of being last for introduction. Thank you very much, Dr. Young and Donald Trigg. I'm the president of Cerner Corporation. We are a sort of classic entrepreneurial picnic table conversation that became a Fortune 500 company playing at the intersection of healthcare and IT. So this is a space that we've spent a lot of time thinking about over the last 4 decades. Maybe I'll just echo a couple of things that others have said and see if we can drive it into a dialogue, Dr. Young. But I think first and foremost, as you said, and as Paul also said, this COVID impact, this COVID as an accelerator of secular force of change, I think is a real dynamic that's playing out. And I think we've struggled at sometimes at the country level to think through this constellation of public health, economic well-being, and individual rights. And I think this does shine a bright light, as you said yesterday, on that topic set. I think secondly, this concept of trust, which Samantha sort of framed up and which Paul also talked to as sort of what we can expect of the individual. When you look at the Pew data, it is striking to me that 80% plus of Americans say the benefits of data aggregation are not outweighed by the costs and the risks associated with that. So what does it look like to create a high trust ecosystem that has heavy buy-in from the individual around approach? I think that's a critical dimension. I think for us, mostly operating historically in the provider ecosystem and in the world of covered entity, we have focused a lot on data liquidity and what it looks like to have true plug and play interoperability, transparency, so people understand provenance and consent and how the data is being used. And then I think importantly, accountability. And you see that as Samantha alluded to in 21st Century Cures and how we think about not only the incentive structures for individuals to feel comfortable with data sharing, but also the right penalties so that when bad actors are at work, we have a framework in place that allows it to have accountability and to address it. So mostly just amplifying on a set of things that were framed up, but thank you very much for having me, and I look forward to the discussion.
Don, we're going to get to your latter point here in just a minute, but I want to turn to Jacqueline and do so because of the personalized healthcare interest of things. But do you have some reflection on what Don just said a minute ago about the comfort that people have with massive data that drives personalized healthcare being shared either in an unregulated environment or a very tightly regulated environment, and where we should stand between those 2 points?
Yeah, thanks for the question. I think in the context of personalized healthcare, obviously getting access to individual patient level data and being able to draw insights from that and to inform patient care and treatment decision, I think is really critical in order to tailor the care for the patients. I think this is where we see some really different sort of tensions coming in terms of the desire to better use the data and the challenge of actually getting access of the data because data is sitting in silo, as well as the concern on data sharing and data privacy. And how do we balance that such that we can actually get to really meaningful use of the data and drawing insights that could be really beneficial to the patients and to society, and to advance the healthcare ecosystem, but also at the same time protect patient privacy and patient concerns in terms of how others have access to the data. This is such a fundamental problem because of the policy not being established yet, and as well as the infrastructure and this technology may not already be in place to protect that sort of privacy. And so I think there's a lot of problems and challenges that need to be tackled in order to advance that space. And I think in the context of COVID, that the need and the opportunities to use data and to drive innovation has really advanced a whole lot in the last few months of really recognizing the value of data. And so maybe that is an opportunity for us to think about how really to leverage the current situation to tackle those problems that can really be meaningful to advance the space.
Yeah, I think that point is very, very important, and particularly in COVID, for example, to protect our healthcare workers, we have established COVID Pass, which is an electronic self-screening tool to be utilized to ensure that individuals are asymptomatic, afebrile, et cetera, before coming to work. And obviously, with 60,000, 65,000 employees in the Cleveland Clinic, including me, that's a huge job. And there's been some question about the comfort that people have sharing that kind of data, as well as whether or not honest sharing of the data will occur. So regulation of this sort of thing for a healthcare provider to get data like that is a little bit murky at the moment. I'm going to pitch this one to Tom a little bit. He's out, I know, in sunny California, down not south, but sort of in my favorite place.
Your old stomping grounds.
Yeah, out in that neck of the woods. And you alluded to the fact that the regulatory issues haven't caught up. Everyone's kind of focused on that. What do you think's the best system? A federated system where we have each state creating their own case of regulatory oversight, or a more centralized governmental system? Where are we going to go? California has different rules than Ohio does.
Yeah, and that's part of we're all early in the journey, and everyone's wrestling with how to do it. So you look at our normal provisions around things like HIPAA, which most people in the United States understand if you're in healthcare. And then you look at the provisions being created in Europe through GDPR, which are a very different set and a certain type of approach that's different. And then you look at what's happening here in California, where at a state level, it's almost the blending of some of the GDPR with some of the normal standards that are also still in place here in the United States. So I think sooner or later, we're going to sort it out. I can't imagine that, just like so many other issues on licensing of practitioners and how that gets in the way of, if it's state by state, how does that work? Whether it's how healthcare increasingly is working today across state borders, or what it is that then we can give to the individual consumer to help them understand what's within their right, whether it's wanting that data, closely held, or whether it's they're saying in exchange for something that's important to me, I'm willing to allow others to have broader use of that data. And beyond this, again, we will figure it out, but clearly the capabilities, as Paul was referring to, not just the capabilities, but the desire of a large number of consumers on what to do in the digital space is out ahead of the legislators and the regulators, but we will eventually catch up.
So good comments, and I'm not sure what the best way to push things to catch up is, but we might consider how to do that. Paul, I want to jump to you to talk a little bit about decisions that you make about product development and engineering to bring out new things. It seems like every other day I'm getting a hit about a new idea, new concept for some sort of cardiovascular monitoring device. The most recent one being an incredible AI-based development of analysis of EKGs for QT interval. Obviously, something really interesting if we're going to be taking hydroxychloroquine right now. But what are your thoughts on that and its link to regulatory oversight?
Yeah, no, it's a great question. It's interesting that clearly health is a continuous process. It's our bodies and everything we're constantly moving and constantly on the go, and our health is really a day-to-day thing. And what's interesting when we sort of look at other industries outside of health, that I've been at Google for 15 years and I've worked across many different products on the consumer side, enterprise side, research, et cetera. And the amount of continuous measurement and monitoring and with AI technology as a way to sort of get to some of the underlying things that are going on in these systems, and then to slowly improve them over time is pretty fundamental to every industry that is engaging and that we're working on. And so what's interesting, we now come into healthcare and start looking at what's happening here. Clearly, there's an opportunity to make healthcare also more continuous, as you said, especially around things like cardiology. And but that's going to require, I think, not only the rapid evolution of all the devices and analysis capabilities, but also of the two sides of these surfaces. So on one side we have the consumer, and the other side we have the clinicians. And we talk about the patient versus the consumer. And the question is, when does the consumer and the patient sort of become one thing on one side? And how do we have those two sides work together? So I think that one of the core aspects here, Dr. Young, is really the partnerships that need to happen. And I'm going to just pop this up a level for a second. No one company is going to solve all these issues. There's so much innovation and opportunity to dramatically improve health, both in the acute settings as well as at home and all these processes. But we're going to need to work across organizations and partnerships with all folks here and that are also watching to make sure that we're actually delivering on those opportunities and creating those value propositions. So I'm really excited about the partnerships and the innovation in the AI space. As Tom also was touching on, is just it's so incredible to see some of the innovations that are happening there. In our imaging research business, for example, we've been working on things like fundus images for diabetic retinopathy. But as we start to look at the back of the fundus, we realize, wow, this is a window into cardiovascular function. Right. And now we're starting to realize there are cardiovascular signals, by looking at not just still images, but video in the back of the fundus. And so there's just so many opportunities. And sometimes there are things that are surprising that come out of this. So we're excited to push both on the research, but really in partnership across the organization to see how we kind of create this more continuous system.
Yeah, Paul, your comment about the fundoscopy aspect of things resonates well with me, because we have several AI, augmented machine learning things that are going on with that right now. And it reminds me of something that has occurred to me. I've been in the business now close to 50 years. And really was captivated by stethoscopy, listening to somebody's heart with a stethoscope. And now I tell people that the only reason I do that, or did that before COVID, was to touch the patient. Because you can't do, no matter how expert you are, you cannot do an adequate auscultatory examination of the heart anymore. When you're compared to something like a simple echocardiogram and with the handheld devices, et cetera, et cetera. So the paradigms are changing. But let me get back to a point that you made about partnership with industry, partnership with providers, and partnership with professional institutions, and come back to Samantha and pitch that question to you in your role with the American Hospital Association. How do you look at the ability to partner with both frontline organizations that are developing these tools, with legislative organizations that are setting up the guardrails and the groundwork, and then the insurance groups that are paying for a lot of this work? How does the AHA look at this?
So I think we really look at it, or try to look at it, in a very multidimensional way. I think that especially amongst policymakers, sort of earlier in this journey, there was a bit of a setup of its providers against technology, providers against developers, was a dynamic that was set up a little bit. And I think those barriers are coming down as more of these partnerships take place. And I hear every day from our members about a new partnership that they're doing, including with some of the companies represented on this panel, that are really, really critical to their goals that they would like to achieve. I think COVID has both exposed opportunity, but also exposed gaps. I think there's a wide variation across the hospital field in terms of sophistication, resources, when it comes to be able to be in a place to really utilize data and form these partnerships. I think we can't ignore what you just said, which is certainly the payment side of things, and how is payment evolving to recognize some of these important tools. I think we've seen a little bit of progress with CMS in the sense that they've somewhat decoupled traditional telehealth from remote monitoring, and are now looking at potentially paying for some AI codes. So I think we are seeing a little bit of progress, but I think it all supports each other. They're almost all legs of the stool in a way. And so I know that we are always very supportive of our members who are looking to build those partnerships. We have an AHA, Center for Health Innovation, that does some of that on its own as sort of a separate part of the AHA. So I think it's really something we've embraced, especially in the last few years.
How does the group think engagement of not only patients? I like to use the term people more, because we've got to engage people more than we engage patients today. And these tools, I think, may be more attractive to people than patients. So, you know, you can't go out for a walk or a run and be checking, you know, and punching on their wrists. How many of you have one of those devices on right now that can measure just an extraordinary amount of data and information that can be shared, is shared in many different ways. So your point about the insurance companies paying for some of these things, I think, is a critical one. It's highly variable right now. Personally, I think as we move towards an accountable care organization type of payment, so a population, the old-fashioned, you know, per capita kind of per month payment system probably is going to help get us there, at least in maybe the Medicare population. So who has thoughts about that? How to move that forward?
Well, Dr. Young, I'd just say, you know, Tom kind of started us down this path saying, you know, sort of the past is prologue. If you look at what played out in the 90s and the evolution of that played out in the dot-com era. And then I think we got into a really interesting discussion here. You know, Paul sort of started with, how do you think about person, to use your construct, Dr. Young, and provider, but then very quickly we got to payer and to policymaker as meaningful dimensions of how you think about the wide lens kind of view of what's the constellation of interests that would have to come together to create national consensus and drive forward an approach. And I think Samantha's right. You look at things like telehealth, which have seen a ton of diffusion and adoption, mostly a function of administrative change and rethink around licensure and rethink around reimbursement. So in the context of COVID, we've seen that play out in a very real way. And so, you know, now we are going to get to the question you asked earlier, Dr. Young, which is, how is this going to play out? Are we going to let it play out on a more federated basis with things like CCPA becoming a proxy for an emergent federal approach? Are we going to see federal preemption? And then across all of those stakeholders, what's the scope of that change that we're really going to tackle and take on, to include the consumer app ecosystem and FTC related topics, which are, I think all of us would agree, a meaningful dimension of how you want to define scope here and think about relevant data assets for health and care. So that's the conversation we're having, and it gives you a sense of the magnitude of the topic set and what needs to happen as we play forward post-COVID.
Paul, if you had to summarize where you think that we should be driving this, which route would you take? Would you take the federated kind of local route, or would you take a more overarching industrialized approach to things?
It's a great question. So, I mean, it's hard, as you said earlier, it's hard, I think, for this, sort of central government to, in some ways to sort of keep up with some of the, how things are changing. So I do think it's going to need to be, a kind of coalition of industry folks and across different disciplines to move this forward. I think one thing we have to be careful about, just wanted to highlight, is also leaving the person behind a little bit. I think, when we looked at, we do a lot of, user experience research across our services, and we find, like health literacy is a big issue, right? And so even as we have these new innovations coming out and new wearables and all this stuff, when we first looked at, for example, at this sort of CDC COVID screener, and we started like analyzing it and working with them, the first versions that required a very high level of sort of health literacy to be able to understand what the thing was even trying to tell you. And so I think that we got to be careful that we don't leave, that the industry works together but doesn't leave people behind. I think that we really need to bring their voice in, I think, both through the patient advocacy groups and organizations, but also directly from our consumers and patients that we interact with, to make sure they're part of that conversation. But I think it's going to need, it's going to need to be a partnership across organizations in the industry, and to really step in and do the right thing. I think everyone here on this panel, it's fantastic sitting, next to, companies that in some contexts we might consider ourselves competitors, but really that's, we're all in this for the right reasons, and we're thinking like, hey, how do we have impact? The real competitors are diabetes and hypertension and these issues. So we just need to work together to figure out how to bring the right changes to policies in place, but also bring, I think, the consumer along that journey. I think that's really important.
Tom, do you think the consumer, as Paul just alluded to, understands the importance of using their individual data, but when aggregated, to come up with AI solutions for algorithms to treat individuals? Do you think the consumer understands that?
Well, I think the short answer is no, not really. Beyond that, I think that is central to all of this in the discussion. A lot of it's situational. If you talk about it in the academic, many people will clearly side with the protect my data. I want to be in control of it, and they should be. At the same time, that also implies their ability to do things or have others do things with their data that they believe is in their common interest or good. So, I'm struck by this conversation, and several speakers have already mentioned it, but it's like, when will we erase the boundary between a citizen being a consumer versus a patient? The data really should have that as a continuum, as Paul suggested, number one. Number two, for all of the things we discuss about the need to really make sure we lock this down, and we will have much better guardrails going forward, as we always do. But at the same time, I look at studies on where consumers are. There was a great study published this summer by Change Healthcare and the Harris Polling Organization that shows half of all consumers in America, when they have a need to enter the health system, don't even bother because it's such a hassle to seek care. And that same study showed almost everyone wants healthcare to be, more accessible, a better experience. And it points to most consumers wanting that to be, where possible, a fully digital experience. So I look at what increasingly I believe consumers are not only wanting, but demanding. They will vote with their feet to seek out that care. And so how do we meet the needs of consumers on their terms? How do we truly create this personalized care situation? Because the needs of millennials are different than boomers. We have the ability with the technology, with the use of the data. And to me, it's about looking forward on what we can do to truly make healthcare better, and then make sure we've got the guardrails necessary to protect people. But it comes down to, I always flip this around to say, what are the great upsides that consumers expect from us? And then how do we have our data policies match what consumers really want?
Good points. We've got 1 minute left. Jacqueline, I'm going to pitch it to you to have the last word since you're hip deep in personalized medicine. So 40 seconds left.
Yeah, I think it's really critical to push for a more holistic discussion and to tackle the problems together, because we have seen data sitting in silo and lack of data standards being a real barrier for using data more meaningfully. I do think also there's a need to create quick wins across the ecosystem so that we can continue to incentivize patients and the healthcare ecosystem to see the value of using data in a more meaningful and sophisticated way. So don't shoot for the moon only, but also create quick wins along the way so that everyone can see the value.
Well, if you shoot for the moon, you might miss and land the stars. So no problem with that. And with that, I want to really thank the panel. It's been a great interchange, a great discussion. Taking notes here, I've got a little bit of a long list that I'm going to have to deal into. So thank you for being with us today. Thank the audience for being with us today. And I hope we can bring this group together down the road. Thank you very much. And we'll let you all sign off now.
Thank you, Dr.
Thank you.